There is a list. It is a federal list, maintained by the government's own watchdog agency, updated every single month and available to anyone with an internet connection. It contains the names of doctors, nurse practitioners, pharmacists, and other medical professionals who have been formally barred from billing Medicare. Barred, not suspended pending review, not under investigation. Barred, meaning Medicare will not pay a single dollar for any service they provide, order, or prescribe. As of right now, that list has 82,229 entries. And here is the part that most people over 65 have never been told. You are allowed to search that list before your next appointment. You can type in your doctor's name right now from your phone or your computer and find out in under a minute whether the person treating you, the person whose prescriptions you fill, whose referrals you follow, whose orders you trust, is on it. Most seniors have no idea this search exists, and some of them have been paying for or receiving care from a provider who should never have been billing Medicare in the first place. That list is called the LEIE, the List of Excluded Individuals and Entities, and it is one of several things covered in the federal government's most recent fraud report, a report that also documented the largest healthcare fraud enforcement action in the history of the United States Department of Justice. I want to walk you through what that report found, why it matters specifically to you as a Medicare patient, and the 3 things you can do this week, all of them free, to make sure that none of the schemes described in that report have touched your care or your Medicare record. Before we get into it, I want to hear from you. Have you ever received a bill for something you did not remember receiving? Or a call from a company offering you free medical equipment or genetic testing? Drop it in the comments. What I am about to share will explain exactly what those calls were about. And before anything else, everything I share here is educational. It is not personalized legal or medical advice. For guidance on a specific situation, please speak with a licensed professional or call 1-800-MEDICARE. With that said, let us get into the report. My name is Walter Barron. I am a state bar licensed estate attorney, and for more than 15 years, I have worked with families on the legal side of Medicare, healthcare billing, and what happens when the system that is supposed to protect you is the one taking advantage. Let us get into it. The report I am referring to is the Fall 2025 Semiannual Report to Congress from the Office of Inspector General of the Department of Health and Human Services. The OIG releases this report twice a year. It summarizes every major fraud investigation, audit finding, and enforcement action that took place during the reporting period. The Fall 2025 version, released in January 2026, covers the 6-month period ending September 30th, 2025. And what it describes is not a normal reporting period. During those 6 months, the OIG and the Department of Justice announced what they called the largest healthcare fraud takedown in the history of the United States. 324 defendants were charged. 96 of them were licensed medical professionals, doctors, nurse practitioners, pharmacists. The fraud schemes they were connected to involved over $14.6 billion in intended losses to Medicare, Medicaid, and other federal health programs. That number more than doubled the previous record of $6 billion, which was set just 5 years earlier. Let that land for a moment. 96 licensed medical professionals charged in a single enforcement action across 50 federal districts and 12 state attorneys general offices. The OIG described it as unprecedented, and the schemes those professionals were involved in are not abstract or distant. They are schemes that specifically targeted Medicare patients, which means they specifically targeted people over 65, people like you. The first major category of fraud in the report is one that the OIG has been tracking for years and that exploded in scale during the COVID telehealth expansion. It involves wound care products, specifically a category of products called amniotic skin substitutes, sometimes marketed as advanced wound treatments. Here is how the scheme worked in practice. A company, sometimes operating under the name of a legitimate medical supply business, would contact Medicare patients, often by phone, and offer them free or low-cost wound care services. A doctor connected to the scheme would then order expensive skin substitute products for those patients, frequently without ever meeting them in person, often through a brief telehealth call that was sometimes fabricated entirely using artificial intelligence to generate fake patient consent. The claim would then go to Medicare for thousands of dollars per patient. According to the OIG report, Medicare Part B expenditures on wound care products exceeded $10 billion annually and grew by more than 600% since 2023. 600%. The OIG identified this as one of the single largest drivers of fraudulent billing in the entire Medicare system. And in the 2025 Takedown, prosecutors charged defendants with submitting $1.1 billion in allegedly fraudulent wound care claims alone, just in that one category. The people running these schemes were not small operations. They had call centers. They had scripts designed to get Medicare beneficiaries to agree to a service they may not have needed. They had physicians on payroll whose job was to sign orders for patients they had never examined. And they had billing departments that knew exactly how to submit those claims in ways that were harder for Medicare's automated systems to catch. What this means for you directly. If you have ever received an unsolicited phone call, a text message, or a direct mail piece offering you free wound care, free skin treatments, or a visit from a medical professional to assess your skin at home or through a video call you did not request, that contact may have been part of one of these schemes. And if you accepted that offer, there is a real chance that claims were submitted to Medicare in your name for services that were medically unnecessary, never properly ordered, or never actually delivered the way they were billed. Your Medicare record may show charges you never consciously agreed to. The second category is closely related to the first, and it involves a tool that most people think of as helpful: telehealth. During the pandemic, Medicare expanded access to telemedicine dramatically. Those flexibilities allowed millions of patients to see doctors remotely. They also opened a door that fraudulent operators walked straight through. The OIG's report describes schemes in which telehealth companies paid kickbacks to physicians to generate orders for durable medical equipment, back braces, knee braces, wrist supports, and similar items, as well as for genetic testing kits and prescription medications. The physician would sign the order after a brief call, sometimes with a patient they had never treated before and would never treat again. The equipment would ship, the claim would go to Medicare, and the physician would receive a payment from the telehealth company that had nothing to do with the quality or necessity of your care. The OIG calls this a kickback, and paying or receiving one in connection with a Medicare claim is a federal crime. In February 2026, CMS announced a 6-month moratorium on new Medicare enrollment for certain categories of durable medical equipment suppliers, a direct response to the scale of fraud the OIG identified in this space. And the OIG's own data analytics system, which now uses artificial intelligence to scan for unusual billing patterns, flagged and stopped more than $4.4 billion in Medicare payments in a single investigation. Payments that were scheduled to go to a network of fraudulent medical supply companies before the AI system caught them. The scale of this problem is hard to absorb, so let me make it personal. If you have received medical equipment in the mail that you did not specifically request from your own regular doctor, there is a question worth asking. How did that order get placed? Who signed it? Was there a telehealth call with someone you did not know that seemed unusual or very brief? If the answer to any of those questions is yes, your Medicare record may show a claim connected to one of these schemes. And depending on how the claim was coded, you may have received a bill for a coinsurance or deductible amount that you were never supposed to pay. You were the target, but your Medicare record was the vehicle. The third category in the report is newer, and it is one that is growing fast enough that the OIG flagged it specifically for heightened oversight going into 2026. It is called remote patient monitoring. Remote patient monitoring is a legitimate Medicare benefit. A doctor enrolls a patient in a monitoring program. The patient receives a device, a blood pressure cuff, a glucose monitor, a weight scale, and the device transmits readings back to the clinical team. Medicare pays the doctor's practice for each month the patient is monitored and for each time the data is reviewed. The problem the OIG identified is that some providers have enrolled Medicare patients in monitoring programs without establishing a real clinical relationship, and then billed monthly for data review services that were never performed. In 2024, nearly 1 million Medicare beneficiaries were receiving remote patient monitoring services. The OIG found that certain practices did not bill for any actual treatment management services for 75% or more of their patients, meaning those patients were enrolled and billed for, but the monitoring data was never being used to guide their care. The OIG announced a formal audit of Medicare Part B remote patient monitoring services with an expected report in 2026. And the concern here is not just that patients were billed for monitoring that was not happening. It is that some patients were enrolled in programs by vendors, not by their own doctors, who approached them directly through advertising, phone calls, or television promotions, signed them up for a monitoring device, and then billed Medicare month after month without a real clinical relationship in place to make use of the data. If you are currently enrolled in a remote monitoring program that was offered to you by someone other than your regular physician through an ad, a phone call, or a sign-up at a community event, that program may not have been established the way Medicare requires. And if you cannot recall agreeing to a monitoring program that appears on your Medicare statements, that is a specific thing worth investigating. Call 1-800-MEDICARE and ask them to walk you through every active enrollment on your account. You have the right to see that information and the right to disenroll from any program you did not knowingly and voluntarily join. Now let me bring this back to the list I mentioned at the very beginning, because this is the part that changes what you do after watching this video. Every provider charged in the 2025 Takedown, and every provider convicted or excluded as a result of any fraud investigation, ends up on the list of excluded individuals and entities, the LEIE. The list is maintained by the OIG. It is updated every month, and it is searchable by name at oig.hhs.gov. You type in a name, and the database tells you immediately whether that individual has been excluded from Medicare participation. The search is free, it takes about 60 seconds, and it is one of the most useful tools that Medicare patients have, and one of the least known. The list currently contains 82,229 names. And here's the thing that most people do not understand about exclusion. When a provider is on the LEIE, Medicare does not pay for any service they provide, even if the patient does not know they are excluded. Even if you have been seeing that provider for years, even if your insurance card still works at their office. If you receive care from an excluded provider and a claim goes to Medicare, Medicare can deny that claim. And the denied amount can come back to you as a bill you did not expect and do not owe, but have no easy way to fight without knowing the underlying issue. This is not theoretical. In 2025 alone, the OIG reported that healthcare organizations paid more than $26 million in civil monetary penalties, specifically for continuing to employ or contract with excluded providers, a 6-fold increase from the year before. The problem is real. It is growing, and it is landing on patients who had no idea because nobody told them to check. There is also a second layer to this that most people miss entirely. Exclusion from Medicare does not just apply to the doctor who was convicted. It can apply to the billing company they used, the practice they worked for, or the supply company they were connected to. If any part of the network providing your care was excluded, the claims coming out of that network may be affected. The LEIE covers individuals and entities, meaning companies, practices, and suppliers, not just individual physicians. So the question is not whether excluded providers or excluded entities exist in your community. They do, in every state. The question is whether you have ever searched. Let me leave you with 3 steps that cost nothing and that together take less than 15 minutes. I want to be specific about exactly what to do for each one, because the general advice to check your Medicare records is not useful without the details. The first step is to search the LEIE right now. Go to oig.hhs.gov and click on Exclusions. You can search by the name of any provider: your primary care doctor, your specialist, the physical therapist you see, the pharmacist who fills your prescriptions. If the name comes back clean, you have peace of mind. If it comes back with a match, you need to verify whether it is the same individual. The database includes date of birth and national provider identifier where available. And if it is, you need to stop allowing that provider to bill Medicare on your behalf and call 1-800-MEDICARE to understand your options. The second step is to look at your Medicare summary notice or your explanation of benefits from the last 12 months. You receive this statement in the mail, or you can access it at mymedicare.gov. You are looking for claims you do not recognize, services billed on dates when you were not at a provider's office, equipment you do not remember receiving, genetic tests you do not remember agreeing to, wound care products that arrived without a clear conversation with your regular doctor. Every line on that statement represents a claim filed in your name. If something does not match your memory of your care, write it down and call Medicare. The third step is to report anything that does not look right. The OIG's fraud hotline is 1-800-HHSTIPS. It is free, it is confidential, and it is how the government's own investigators find out about schemes that are still active. If you have received unsolicited calls offering free medical equipment, genetic testing, or skin treatments, even if you said no, that call is worth reporting. The 2025 takedown that recovered $14.6 billion in intended losses started with tips, data, and reports from the same people these schemes were targeting. The report is public. The list is searchable. The hotline is open. The only thing between those tools and your protection is whether you know they exist. Now you do. If you know someone over 65 who has received an unexpected medical bill or an unsolicited offer for free healthcare services, please share this with them. Thank you for watching.